that stubborn earache that you have that doesn't go away with antibiotics, that may not even be an ear pain. It can be coming from your neck. Let me explain. The nerves and muscles in your neck can actually trigger pain going to your ears, making you think you have ear issues when in fact it's not an ear issue. So what ends up happening is you have tight muscles in the back of your neck. You can have forward neck posture, which causes tension on the muscles in the back of your neck. It can cause tension in the jaws, and that can actually shoot pain to the neck, to the ear area. And you can have trigger points in the muscles in the front of your neck that shoot pain and give the illusion that it is actually an earache when it's not. So what ends up helping is correcting all the leading causes and whatever feeds the root cause of all this tension and nerve irritation. What ends up happening is you need to look at your lifestyle, look at your work environment. I know you probably know about ergonomics. What you don't most likely know is that the size of your keyboard needs to be as wide as your shoulder width. Because when you're typing and your elbows start going closer to your body, you end up rolling your shoulders forward, which then encourage this posture and collapse over here in the process, and the neck goes forward. All of these mean you end up tensing up the muscles in the neck, irritating the nerves coming from your neck. It impacts your breathing, and it's a downward spiral from that point on. Once we fix the things that are also feeding this problem, we want to start fixing the patterns of movement that we've created as a result of the poor posture that came along here. So what method I use is developmental exercises. These are the same exercises that got you as a newborn baby to become a running toddler. Every single one of us went through that process the same exact way. That means we're hardwired to follow those patterns, and our body parts know exactly what their roles are, and we do them over and over without realizing how well these are put together. So when it comes to solving the problem, we use the same methodology to fix the problem, removing the things that feed the dysfunction. Biological breathing is the first step in the right direction. If you have not subscribed to my channel, it's a great opportunity for you to make sure you subscribe and you turn the notification bell on, because that way when I post something, you get to see. Biological breathing is something I talked about. We'll make sure that we put it at the end of this video, but make sure you subscribe and make sure you follow us there. So biological breathing is how the different parts of your body connect with each other and continue connecting at a frequency of every breath. Now we want to go and fix this thing. So after the biological breathing, the beginning step with developmental exercises, start with what we did as 6-week-old, then what we did as a 3-month-old, and then what we did later on in life. So let me show you how these exercises are done, and let me put this down. We start by activating the back of the neck muscles, and this is how we do it. You're going to be on your tummy, and of course you're breathing biologically. Your elbow creases are at your ear hole level. You are on your forehead. You're pressing the inside of your elbows to the floor and gently sending your shoulder blades down your back, so the top of the shoulder gently goes away from the ears. You're pressing, you're breathing biologically. You scrape your nose, you get the tip of the nose off, you look up another couple of inches, and you hold your head. That means the head movers did their job, and now they're holding on. During this exercise, you're not squeezing your butt and you're not activating your lower back. Now, between the shoulder blades, there is a muscle that goes on both sides of the spine that go and get connected to the back of the neck. You use that muscle to pull your neck up. Make sure you don't look up. That's not going to help your back of your neck muscles. So you're going to pull up and hold as you're pressing the inside of your elbows to the ground, and you turn your head one way, go to the center, slowly go the other way, and you go down. This is what you did when you were 6-week-old to 3 months old. The next thing you want to do is you want to continue on with what you did towards the end of the 3rd month. Here, instead of your elbows being there by your side, you move your hands right under your shoulders. So your fingers are under the shoulder, not too far back and not partly in front of your shoulders. Once again, you're on your forehead. See how my elbow's above my body level? That's how it should be, and it shouldn't be sticking out or squeezing my body. You go from scraping your nose, getting the tip off, look up a couple of inches, hold your head in place. You're breathing biologically, you're not squeezing your butt. You are gliding between the shoulder blades, gliding the neck up, top of the shoulders away from your ears, and then from your elbows to the wrists, you push and you lift yourself up. Just the sternum, just your rib, your chest bone goes off the ground. This is not cobra. You're just lifting this up and holding. This is when you're activating the back of your neck muscles to work with your shoulder blades, to work with your mid-back, to hold your neck up, and you're not using your head movers to do the neck movement. Very, very important. The next thing that I want you to do is do something that has to do with in a seated position. So I'm using the same muscles, only asking you to practice this in a seated position. So as I'm seated, I'm sitting, and my neck is forward, a lot of times when I say glide your neck back towards the back wall, people tuck their chin and shove the head back. This is not how it works. You did not use the back of the neck muscles to pull it back. They still did not get to play. What you want to do is you want to, again, go to the muscles in between the shoulder blades on the 2 sides of your spine. There are muscles that go all the way up, connecting to the back of your head, that glide the neck back. Just like when you were on the floor, you scraped the nose, got the tip off, looked up a little bit, and then you, between the shoulder blades, started gliding back. Don't tense up the muscles in the front. Concentrate on gliding your neck back, and if you tense up your jaw or you drop your chin down, you did it wrong. It's going to take some practice because you haven't done this in a long time. When it comes to fixing dysfunction and bringing functionality into your movements, you are killing bad habits. That always comes with patience, that always comes with understanding what it is you're doing, what body parts you're using, and how to use it. If you have chronic earache, if you have chronic neck issues, contact my office. Let's chat and see if this is something I can help you with. Meanwhile, make sure you subscribe to the channel, and until next time, take care.